Started. Welcome everyone to this month's Open Policy Learning Collaborative call. I'm Stacy Chazen with Open, and it's my pleasure to welcome you today. Today's call is being recorded, as they all are, and we'll be sharing the link with members of Open, actually with members of this learning collaborative through a link on our YouTube channel, and we'll be sharing it via email so folks can access it afterward. Please keep yourself on mute till you're ready to speak. And as always, we encourage you to use the chat box. We also encourage you to add your personal pronouns to your RingCentral screen name. And with that, I'm going to turn it over to Annalise Cawthron.
Hi, everyone. Welcome. I am one of the co-facilitators of the Policy NRT along with Tanya. Tanya, you want to say hi?
Hi. Hi, everybody. Happy fall. It is, it's like 55 degrees or something here, and it's like heaven because it was 100 on the first 2 days of the week. So I'm in heaven. Happy fall, everybody.
And in Texas, it is 90. So cannot share in that fall delight with anyone just yet. But thank you so much for being here. As I mentioned, we have, Tanya hates the heat. As I mentioned, we have the agenda in the chat today. Our other co-facilitator, Sarah Holland, could not be here. She sends warm regards. But she did help put together the agenda. So we start off with 10 minutes of open business. And Stacy, would that be you, or is there anything to discuss for open that you want to pop into there?
So one thing I'll just promote, it's somewhat self-promotional because I'm working on it, is as we did this summer, we're going to be offering a webinar for interns of open member organizations as a way to introduce, I guess, the next generation, so to speak, to Open. We'll be doing some version of the new member orientation that we've done in the past, but also with some content more geared toward the intern group. And then we, as we did in August when we offered this, folks go into breakout rooms of 3 or 4 so they can have an opportunity to network with one another. We had a very small group last time. I think we had 4 or 5 interns participate. So we put all of them in their own breakout room away from staff, and we got such phenomenal feedback about the experience. Like they really enjoyed learning about Open, and maybe even more so enjoyed the opportunity to learn about what others are doing in the network that are in related fields. So it was pretty exciting just to see how genuinely appreciative and how much they valued the experience. So if you have interns working with your organization, please encourage them to sign up. It is taking place on October 20th from 12 to 1:30 p.m. Eastern time. And the registration link, I'll pop it in the chat box during this call. It was also included in the Creating Connections newsletter that went out yesterday. So that's all I've got, really.
Thanks for sharing that, Stacy. Any questions for Stacy or thoughts or feedback?
Oh, and I'm totally remiss in not acknowledging that I'm partnering with Rebecca Kislak on doing these calls, who is here but off camera. So Rebecca and I led the last one, and we're doing it again next month.
Lovely. Any additional thoughts, feedback? Okay. Hearing none, I will launch us into the next section of our agenda, which is to discuss the federal policy landscape. One suggestion that we had was to follow up from last month's conversation regarding an oral health Hill Day. So we did spend a pretty large chunk of last meeting discussing the viability, the feasibility, the need, the desire for an oral health Hill Day, knowing that this is something that Open has tackled for quite some time. To give just a little bit of historical context in case this is the first time you're hearing about that, Open has engaged in kind of this National Hill Day where we focus on policy topics for oral health. And in the past, we have focused on things like Medicaid and Medicare and expanding CDC funding for states, et cetera. It really is dependent on all of you and where we feel like, one, we can make some momentum and make a good ask, there's an opportunity. And then two, what the group desires, the needs are and what we should focus on. So it kind of goes both ways. And Community Catalyst and Families USA has traditionally helped us kind of craft these along with coordination and facilitation of these Hill Days. We had an in-person Hill Day in 2019 where everybody went to Baltimore and then went to DC, and we actually got to advocate in person, which was awesome. It was super cool to see everybody there wearing red, talking about oral health, and I really think it was a place of community and momentum for us. And then obviously in 2020, we did not do anything in person, but we did have a virtual Hill Day. I don't believe we had a virtual Hill Day last year, but we had talked about, or maybe we did, and then we didn't. We definitely didn't have one this year. But we talked about last month, just if there's a desire, if there is the capacity and what that could potentially look like next year. Since we have held these in the fall and spring, is there a time frame we want to think about? Is there a format we want to think about, et cetera? So following up from that conversation, the desire was certainly there. There seemed to be a lot of energy around having a Hill Day and an acknowledgement that it is something that we could do that's timely. There are things we can advocate for that would be helpful, and people did feel energized around that concept. It also seemed like the conversation landed last time where a Hill Day virtually would be the best path forward for a few different reasons. One being the cost. Obviously, it costs a lot less to do something virtually. And then two, just with COVID and planning, we weren't sure if we brought people up there, if they would be able to meet in person or not. And so instead of taking a risk, the decision was made that if we pursued it, it would be virtual. And so we wanted to just revisit that conversation with this group in case you weren't at that meeting last month and wanted to contribute more to the conversation this month, along with just discussing how this could happen within Open, what the capacity, the approach could be, et cetera. And I just wanted to make sure that we had this conversation more than once and that decisions were not made with just one group, but that we could continue that conversation more broadly again here today. And when I say I, that is not just me. That also includes Tanya and Sarah. So while I'm saying I, this was actually, again, an agenda that we all three decided on and thought this was the best approach forward. So I'm just going to pause there for reflection, feedback, reaction. I also see folks in the chat, so I appreciate the comments and would invite you to come off of mute and just add to the conversation if you're able.
So this is Colin. I'll just add that, in terms of thinking about this as an opportunity, we're also coming up on midterm elections. We're going to have changes in Congress and congressional leadership. So, one potential goal that I think is worth focusing around is not just advocating on a short list of specific asks, but also taking this as an opportunity to educate new members and new leadership on the issues more broadly.
Agree. I also see a thumbs up from Deb. Bianca and Bailey, I also see that you guys made comments in the chat and would just love to invite you to make comments vocally if you desire to do so.
Thanks, Annalise. I was just trying to think historically what we've done. And I know each year since 2019, we did some sort of, I know one year we did the policy summit, which was, I want to say 2 days. So one day was the virtual Hill Day. And then the day prior were some keynote speakers on issues relevant and current at that time. And then towards the end of that day, we did like the training for the next day, so people were aware of the asks and such. And then I know one year we did more of a day of action that was in the fall. And I think that was because it was just more relevant to do so with whatever the policy ask was that we had. And I think that was optional to do either Hill visits or just post on social. So there were kind of different offerings of what people felt comfortable with doing in terms of just education versus advocacy, which we've talked about. And then I saw Bailey's comment. I think we've discussed, and this is, I think Melissa had talked about timing for 2023. Obviously, I think leadership has to figure out what makes sense for them at Open, but we've talked about like either late February or March, like Colin was saying, once people are in their new office, in their new position, so that we could do that educational touch base is what made most sense in terms of the education piece.
Yeah, I think that makes sense. And yeah, I don't really have anything, I guess, on top of what Colin said, really. Like, I think it's just a good opportunity to champion build, and like knowing we're starting a new Congress with potentially different political dynamics of who's in charge, just doing a little bit of like rebuilding on some of the conversations I think we had in early 2021. And then the other thing I was thinking, I know we've had an approach ask, government appropriations ask in those meetings previously, and so that's also a good timing to get ahead of the appropriations process as well. So yeah, I mean, I think that makes sense to me. I think whether we do it like in person or virtual, I don't know if that's something that we're trying to figure out, I think, like in this conversation, but I think we could also always just kind of table that and see where we're at.
Yeah, I will offer that we should operate under the assumption that there is no open budget for an in-person event.
Thanks, Stacy. I will also reinforce that that was communicated at least with some directness at the last meeting too, that Ife had concerns about the budget as it relates to planning, time, and resources. For sure, it seemed as though Open could not support flying everybody to DC. That is a huge ask financially of any organization, but also just thoughts, as Bianca mentioned, around resources and capacity within Open leadership and staffing, and at what level of support could be contributed to this particular activity. So to Bianca's point, we would obviously have to, Ife was involved in the last conversation, and we would need to keep Open leadership involved in planning moving forward. Ellen, I'm seeing in the chat that you would love to do a Hill Day, and I agree.
We have, hi everyone, it's Lindsay Saylor. I'm from the Michigan Primary Care Association. Was wondering if there's been any kind of evaluation or analysis if the virtual visit is any of value, I guess, as much as an in-person visit. I don't know if that's a relevant question, but.
Oh, sorry, go ahead.
Go ahead, Bailey.
I was going to say, I don't know in regards to anything that Open has done specifically and like how membership felt about the differences. I would say from an advocacy to Congress perspective, most offices, I mean, especially the offices and committee staff that I feel like I spend most of my time, which frankly are Democrats, are still doing a lot of stuff virtually. Like, I don't know anyone who's doing in-person meetings on the Hill. I know there are people who are doing in-person meetings, but no one that I have interacted with very often is doing in-person meetings. So I don't know that it's different from their perspective. I can't speak to the Open membership though.
I was going to say, yeah, Lindsay, I don't think that there has been, I don't recall there being an open analysis of that, but I can say just anecdotally from the work we've done in Kansas, we've had the chance to do virtual Hill visits, both through Open and then in some other contexts as well. And it's actually helped with relationship building a lot because it gets us in front of them more often. And I think it's been really valuable. Also, just like, even though it's recording, I shouldn't say this, but the other really funny thing is we did one really shortly after the last election, and a really new member of our congressional delegation honestly was too new not to know he didn't have to join the meeting. And so he joined the meeting, and that would never have happened, you know, if we'd probably been in person, he probably would have been told, no, sir, you're too busy. So it was kind of nice because then, I mean, he was the one who had the whole conversation with us then. So my anecdotal experience says it's still valuable. There's nothing like being on the Hill, but yeah, virtual still works.
Because I mean, obviously, I think it's much easier, cost-wise, but then just like calendar-wise too, to get folks involved if we did it virtually. We could see a lot more participation.
Yeah, and I think, you know, the landscape has changed perhaps semi-permanently to some degree in that regard. Like, you know, I think a lot of us, even folks, I don't know, Bailey, correct me if I'm wrong, but even folks who are in like DC still a lot of times are having many of their interactions with Hill staff virtually these days. So I don't know if that's going to shift.
I've not physically been to the Hill since 2019 or 2020. So, and I don't know anybody that has. So yeah.
I want to flag in the chat a suggestion from a state legislator who's in this group. Rebecca shared that she's found in-district visits to be incredibly useful. Members often have more time to spend with constituents, and suggested planning a mix of in-district and Zoom meetings.
Thanks for amplifying that, Stacy, and thanks for that comment, Rebecca. So as I'm thinking through the conversation, it sounds like the answer of is this valuable and is there a desire to do this still remains yes. That the group has a desire, that there is opportunity with the midterms, and that relationship building is priority in that space. So I think it's really about timing and capacity and coordination. So it sounds as though NRT leadership perhaps can maybe have a more dedicated conversation with open leadership and start discussing what that looks like, what next steps would be, et cetera. And we can come back to the group with additional information, or perhaps Ife can come back to the group with additional information. I'm hearing now after 2 discussions that this is an area of activation and engagement. Is anyone opposed to that plan, or does anybody want to upgrade that plan? Okay, perfect. So thank you for that discussion. I think it's really helpful, and I really appreciate the insights that this group offered. I do want to also give some airtime to Community Catalyst and Families USA to talk about anything else from the federal policy landscape that we need to know about, or updates, calls to action, et cetera.
Bailey, you want to start or you want me to?
You can go ahead.
So, I mean, I think the big thing right now is, you know, making sure that the government continues to have money to operate. That's what everyone's focused on, you know, up until the end of the month. So, you know, I think it's fair to say that we'll probably see a continuing resolution that gets us through maybe mid-December. It's unlikely it's going to get us into the first quarter of 23. And I don't think that there's going to be much opportunity for people to hang their hats in you know, hang their priorities as a hat on this particular mechanism. I think it's probably just going to be, you know, a fairly clean budget resolution. But, you know, I think October is when Congress is going to be turning its eyes back towards, you know, both, you know, actual appropriations and also what might they be willing to do in, you know, potential end of the year packages. I think there's some expectation setting to be done there in terms of like how big some of those things might end up being. There's a lot of things that we were all pushing for in Build Back Better that we didn't get in the Inflation Reduction Act, including things like Medicare dental benefits, Medicaid adult dental benefits, closing the Medicaid coverage gap in the states that have not expanded coverage. I think, if Congress is going to be looking at health-related provisions, they're going to be probably looking at some of the smaller cost items, like maybe, postpartum 12-month eligibility. I have heard whispers that Medicaid adult dental coverage may still be something that some members are interested in pushing for, but I don't think it's like, currently central to the prevailing conversation on this. That doesn't mean that we shouldn't be engaging in those conversations with members come October, because I think, if there's an opportunity to move Medicaid related things, we should still be making that ask. Bailey, anything you would add there on the sort of legislative front?
No, I think that's all right. Yeah, I think it's good to temper expectations about what can get added at the end of the year, but I think particularly depending on how things go in November, if the House or the Senate go back to Republican control, it's always a good opportunity to say these are important priorities for Congress to focus on, and we know that there's less of an opportunity to address them in the next Congress, which granted is what everyone will be saying about their priorities, but again, just always good to be highlighting these issues as often as possible. And just the only thing I would add is in regards to the calendar, the Senate is technically in for 2 weeks in October, but they're going to be focusing on some defense stuff those 2 weeks. So pretty much once the continuing resolution for government funding passes at the end of the month, they're really not doing anything until mid-November once they're back from elections. So it'll be pretty quiet for the next couple months.
I see your question about pandemic telehealth waivers. I think that's a good flag, which is that, the other part of this conversation is, when does the public health emergency end? I think we're at this point pretty confident it's going to get extended once more, at least. But there's a lot of political pressure to come to an agreement on an actual end date for the public health emergency, which, as we know, triggers a lot of major policy changes that we care about, including, Medicaid eligibility and redeterminations, which means, a lot of people suddenly become majorly at risk for losing coverage. But some of these other policies that are sort of tied to the public health emergency, like, telehealth flexibilities, also, come into question. I think, the ones that are statutorily tied to the end of the public health emergency, and which are slated to, sundown in the first quarter of the public health emergency ending, will there'll need to be a fight on some of those. But some of the other flexibilities, states will still very much have a say in what additional what policies they continue to keep in place. So I think there's going to be a sort of a twofold strategy there in terms of us making the case to state policymakers that, hey, some of these things like telehealth flexibilities have been really helpful at the state level, and you have the authority to keep doing them. And in fact, let's think about how we can expand on these things. But back to the sort of legislative agenda in Congress, one of the other, I think, tricky aspects of this is that ending the public health emergency will be seen as a cost saver, and therefore there's going to be temptation to use it as a bargaining chip to move other policy pieces.
And I would actually just add one more thing about that, which is, and I'm honestly not familiar if this is in this, but another bill or package that people are talking about potentially moving in the lane back is the Prevent Pandemics Act, which is the bipartisan bill that came out of the Help Committee between Burr and Murray. I'm not sure if that is something that is in that bill, but you could always double check through and see if it is included, because I think that's another thing folks are talking about potentially being able to get through in the lame duck session since it's a bipartisan bill.
Colin, I was wondering, you mentioned state Medicaid oral health expansion. We're hearing in the Medicare benefit as well. Do you know if the advocacy around that is also pushing for workforce, in that what I hear from my health centers is they're very concerned with capacity right now. They're scheduling anywhere from 3 to 9 months out, depending on the center. And they just don't know how they can handle an influx of new patients without any kind of infrastructure for capacity, not only workforce, but also like just space and equipment and all the things. We had our annual conference last week, and Sumanir from HRSA was there, and they're looking at these things, but I don't know that they necessarily have kind of all the answers for that. So I was just hoping, that those thoughts are happening as well, along with the advocacy for the expansion of services.
Yeah, that's a really good question. I know there has been some talk of trying to push for a health workforce related bill. I don't know how much traction that really has at this point, but I'm happy to, do a little bit more fact finding on that. I also would say, the other kind of like long-standing priority, especially for our tribal partners, has been figuring out a mechanism for eliminating the restrictions on the community health aid programs expansion to the lower 48 states with regard to dental therapists, which was a provision that got slipped into the ACA's CHAP expansion and has effectively prohibited the deployment of the full expansion of that program in the lower 48 states. So certainly not a holistic fix for workforce shortage, but certainly one that is I think underscored by the inequities that that are inherent in the populations that would benefit most from that expansion.
Agreed. Yeah, I worry if we advocate for expansion of services, but there's nowhere for patients to go, what happens then?
So one other thing I want to mention on the federal front is that there is a relatively new proposed rule out from CMS on streamlining eligibility and enrollment in Medicaid, CHIP, and also the Medicare Savings Program, which is applicable to some Medicaid beneficiaries. This rule does address like many of the concerns that we have long been raising around making it simpler for people to to have their eligibility reviewed, for to kind of mitigate potential opportunities for people to lose coverage in that process. All of that is especially relevant in the context of the public health emergency eventually ending. But one of the other things I wanted to point out that is in that rule are the provisions around the Children's Health Insurance Program. One, the rule proposes to eliminate waiting periods and lockout periods for kids in CHIP. The other is that the rule proposes to eliminate annual and lifetime dollar limits, both in aggregate and also with regard to particular service categories, which we know has been an issue for many separate state CHIP programs for dental services. I mean, it's sort of like the lone holdout in terms of children's health or children's dental coverage where those restrictive dollar limits can still be applied. So it's a little buried in the broader context of the rule, but certainly something that is a positive for the communities that we represent. CommuniCat will also be putting out a summary of that rule next week, and we'll also be working with partners to do probably a template comment letter. So stay tuned on that.
Awesome. So it sounds like call to action from there will be look out for the template letter and consider if you can submit comments. Anything else or thoughts, questions, comments for Colin? When are the responses due?
I want to say November 4th.
Okay. We'll say November-ish, early November.
I'll get back to you on that.
Okay. November 7th, says Bianca. Everybody be prepared by early November.
Yeah, right around election day, give or take.
I think APHA is also around that time. So I guess the discussion is have them prepared in advance. Bailey, I know you're grabbing lunch. Are you prepared to give any updates, or would you like us to wait a little bit? What works for you?
What updates on what?
Anything. I know you said Colin go first, and so I was like, okay, that I thought that meant that you had some things that you wanted to share too.
No. Sorry, I had a heart attack for a second. I was like, oh no, was I supposed to prepare something more than just the making sure that all the federal stuff was covered? No, that's all I had to.
Okay, great. I just wanted to give you space to make sure.
No problem. Thanks.
Does anyone else have anything in the federal policy space? Anyone else have topics, thoughts, updates, etc.?
This is Tanya. I have a thought that I'm going to not be able to articulate this at all. So either I'll just say something quick or somebody else will know more. You can jump in. I know that Tim Ricks is starting to organize a series of webinars, and I think it starts this fall and goes through next year around the Healthy People 2030 oral health pieces. And he's trying to partner with several different national organizations on parts of those. So I just say that to say, it's literally the extent of my knowledge or what I remember right now, but that might be something else we all want to keep our eye on and figure out how we individually, but then as open, might want to participate in those as well. They already started. Thank you, Mike. I knew it would be off a little bit. Thank you.
And AIDPH is contributing to or hosting one in November for the Healthy People 2030. I forget what they're called, the activity around diabetes and oral health. So we'll be contributing to that session. Thanks for bringing that up, Tanya. Any other federal policy discussion points? Okay, so moving to the next piece of the agenda is learning collaboratives, NRTs, and RACT policy calls to action or updates. We can also just throw in state-specific policies and updates there too. I know, is anyone here from the rural NRT who would like to talk about the roundtables? Okay, so I guess I will just update folks on that. The rural NRT is hosting a series of roundtables in September, October, and November. There will be 3. And the last one I think is going to fall on National Rural Health Day, which is November 17th. So the first one is next week, I believe, on the 29th. And essentially they are roundtables that are very discussion focused, where the people who are able to attend and engage kind of co-create the outcomes and the discussion and the deliverables associated with that. So the goal is to take these series of roundtables and then create a document after of recommendations from those who attend these roundtables to really have a consensus-based path forward around some important topics like telehealth and medical dental integration and things that are really important to rural areas, that the kind of think tank approach can help contribute to a series of strategies for improving rural oral health. So I believe those are posted in Open Communities. Each one of them are posted in Open Communities, and the link that I got takes you to Open Communities versus a standalone registration link. So my suggestion is to go to Open Communities and look at the events there. It should pop up for next week on the 29th if you would like to attend and register for that. And then there is one in October. I don't think the date has been set yet. And again, the one for November, I'm pretty sure is the 17th. Okay. Any questions on that? I'm not sure I can answer it, but I can try. All right, hearing none. Any other NRTs or learning collaboratives would like to share out? If not, I will share out from the LGBTQIA NRT, but obviously want to give airtime to someone else if they'd like to go first. Okay. So I do have some updates on LGBTQIA policy, and I don't have really any good news, unfortunately. Just like every time I present out on this. So the one positive thing is that there was a recent ruling from the 8th Circuit Court, which was it's the circuit that has Arkansas. Because Arkansas passed a bill last year banning gender affirming care for transgender youth, and that was ruled as unconstitutional. And so that federal court did overturn that ban, which was great. It does set some legal precedents. And we'll see the implications of that are still kind of forthcoming, because once you sort of take it to the federal circuit, it is expected that that ruling will be appealed and then potentially go to the Supreme Court, where who knows, how the Supreme Court will rule on that case, potentially negatively, and then it sets legal precedents for the entire nation. So the legal strategy here has been really challenging, but the good thing is that at least for now, youth in Arkansas who were receiving medical care and had to essentially medically detransition with some immediacy can go back to receiving their health care, which is great. There was, in case you're unfamiliar, WPATH and USPATH stand for the World Professional Association for Transgender Health, or US Professional Association for Transgender Health. So there's, kind of this international group, and then there are groups by each country. You can be a member of that and sort of have some governance within your country. And they develop guidelines for transgender healthcare. And so they released standards of care every so often. They just released their newest standards of care version. So they released a draft of it last year, and they released the final just a couple of weeks ago. I bring this up because I am sort of on my island of one lobbying that we need to have oral health representation as part of the standards of care. So I get questions all the time about how does, different clinical manifestations, how is that associated with transgender care? What should oral health practitioners be looking for, et cetera? And there just isn't a ton of evidence on it. And there certainly aren't any standards of care brought up about that. So I think it's important for us to understand that this exists, that oral health does not have representation, and there are clinical implications that we should be examining. And so it's kind of a missed opportunity in one respect, but also an opportunity for the next go around to include oral health in the conversation. I think I brought this up at the last meeting or the meeting before, that Medicaid in Florida was considering stopping coverage for transition care. And so now at this point, it has officially stopped coverage for transition care. for youth and adults. So all transgender people who were using Medicare as a benefit for their health insurance can no longer receive transition care through that program, which is really unfortunate. I bring this up because it's expected that that will then inform policies in other states. So you will likely see this attempt to be replicated in other states too. So that's really unfortunate. There is also a bill in the Senate and the House to ban all gender affirming care for transgender youth. It was offered by extremists in both parties. In both chambers. Nobody expects either bill to pass, but as we're talking about the midterms and we're talking about where the House and the Senate may or may not go and how those scales may tip, there is certainly policy offered at the federal level to ban all access to gender affirming care. So it's something for us to keep an eye on and advocate around. So there's that. So current attacks on hospitals, I'm just bringing this up because it's something that is timely and unfortunate, which is extremists are now sort of focusing on hospitals where gender affirming care is happening. The most recent sort of two areas that have been under attack is Boston Children's Hospital and the Children's Hospital in Akron, Ohio. So both of those hospitals, the boards, like the board of directors, are being doxxed. They've been receiving bomb threats at their residents. They've had to shut down both hospitals at one point or another because of bomb threats at the hospitals. And it's because this extremist group is sort of telling everybody, go kind of attack these hospitals because they are mutilating kids. So it's really unfortunate because a lot of doctors who are providing care to all children are now sort of left in this space of getting death threats and things like that. And so they've had to shut down those hospitals multiple times. Since it was really successful at Boston Children's Hospital, they're now sort of replicating this with other hospitals. So I suppose the call to action here is, if you see this happening in your area, just try to provide as much support as you can. The threat of violence is just increasing astronomically. Like, I've never seen anything like this, having been in this space for quite a while. Just the intention to actually physically harm people who are doing advocacy work or even just providing healthcare is something I've never seen before with any other topic. It's very, very extreme. And a lot of people I don't think know about it. So that's why I'm bringing it up, because it does matter and it's very, very scary. So I just think general awareness on that topic is helpful.
And I would say, Annalise, that the response from Boston Children's Hospital has been to double down on supporting the clinic, and that all the providers are unified in that. So I think that's an important piece to talk about as well. Thanks.
Thanks so much, Mike. I absolutely agree. Most of the providers who are in this space are there because they care about the work that they are doing. And this is not necessarily new. Like, people who've been working in reproductive healthcare have gotten bomb threats and death threats and all of that too. It's just very strange to have this much violence be aimed at children's doctors. I think that's where people are just really kind of shocked at the level of vitriol that's in this area. So I'm just gonna pause here. Let me just get through my one additional update and then I will go through the chat comments. So it looks like there's a pretty shocking trend of departments of education attacking trans kids in schools. And why I say this is shocking is because we saw a lot of legislation go through states and not pass. However, the one that was successful, I guess the most successful one so far, has been in Florida, where they passed the Don't Say Trans and Gay bill. And then I think people kind of got wise that, hey, what if we don't pass legislation? What if we just start changing the rules, like from our state boards of education? They just have a meeting and they decide to change policy, and it completely sort of subverts the legislative process, and you can make these changes pretty quickly. Even if you receive a lot of feedback, doesn't really matter. So now we've seen this trend happen in many sort of state policy or state areas where they are changing policy, they offer, a 30-day comment period to say, if you have a problem, let us know. Even if a lot of people say we have a problem with this, those state boards of education are often a direct line from the governor. So if you have a governor who is supportive of that policy or wants to see that policy move forward, there's not a lot of retribution or accountability for changing policies. So I just listed some states where this is happening. So far, oddly, it hasn't happened in Texas. I assume it will at some point, but it's just a really troubling trend. And from a state perspective, I'm encouraging you to please pay attention, because when those comment periods come up, I think it's helpful, even if it doesn't change anything, to still flood them with positive comments. At some point, if a state is sued, all of those comments then come into play for legal reasons. So they could say, the state overturned this policy, even though 90% of the comments were against it. So I do think there is definitely utility in doing that, and just pay attention to what's happening at your state level. And I bring this up every time because a lot of these aren't necessarily and specifically related to oral health, but this has detrimental effects on kids. They kill themselves because of this, and you can't have optimal oral health if you're dead. So I do think that it requires us to be equity champions, to think about whole person health, and to engage in these activities when we can. So, okay, I am going to pause because there's a lot of comments in the chat, and I actually just want to give people the space to come off of mute and either talk about them or ask their questions that way. Rebecca, could I start with you? I see you made a few comments. Would that be okay?
Yes, sorry. Hi. Absolutely. And actually, so my partner, Joanna Brown, just started working at Boston Children's this week too. So she's been sending me in the adolescent health department. So they have a gender care clinic there, and it has been, it's bad. And it's bad here in blue state New England. And I know it's worse in other parts of the country, including Texas. And so I shared some pictures just because it made me really happy to see that some folks in Cranston, Rhode Island, saw that there was going to be this really hateful event. It was school related. It was about misinformation, disinformation about what are your children being taught about gender in schools. We just want to, just the facts, ma'am. We're just going to teach you because we are all concerned parents. And I'm really frustrated with and see lots of parallels of that absolute disinformation around these issues, and have been compiling resources and really thinking about how to counter the disinformation, because there really are concerned parents who really do think that tomboys, wrongly think that tomboys are being turned into girls because of medical pressure to give everybody hormone blockers. And it's just not true. And so I have been thinking a lot about this. I don't have any answers. And I am trying to give space to people who want to talk really, which is sometimes hard because they have some nonsense beliefs. And there are parallels to this and public health messaging around COVID and anti-vax stuff. And in fact, it was my kid who connected people going after me on Twitter for masks with the people who don't like a sex ed bill that I introduced, in part because it's trans inclusive. And the same people, like 20 or 30 people in Rhode Island, are also anti-vax. So it's a small group of people who have figured out and whose messages get amplified, and then they become government policy. And anyway, that's what I have to share. It's bad, and I want everybody to figure it out.
Thanks, Rebecca. I really appreciate that context. I just want to call out too that Colin added a link to the chat. Colin, do you want to maybe give some additional thoughts about what we could do with that?
Yeah, so earlier this year, HHS issued a proposed rule on the ACA's Section 1557 non-discrimination protections. If folks may recall, the Trump administration, introduced a rule to roll back many of those protections. This rule sort of undoes that, attempts to go a little further. Relevant to everything that was just discussed, 1557 is applicable broadly across health programs that receive federal funding, including IHS, all CMS programs. There are, I think, a number of templates and summaries out there. I know Families has one. I think NHELP's portal is great because they have sort of 7 different templates, all of which are very similar in thrust, but which come at the issue from different angles, including protection for trans people. This is an opportunity to take to push the administration on being clear about non-discrimination protections as it relates to gender identity, among other things. And I know that a lot of the groups that worked with NHELP on their comments, have really pushed the language as far as they think it can go in terms of making it clear what choices people have in like the types of facilities where they receive care, for example, for non-binary people. This obviously isn't a rule that will protect against any and all harms that many extremists are pushing for, but I think it's worth us all making clear to the administration that they should go as far as possible with these regulations.
Thanks, Colin. And I think to Shirley's point, what can we specifically do? I think this is a really good call to action. So specifically using the link that Colin mentioned, providing comments. And I just want to point out that Stacy so kindly asked if I had a pet breathing near my microphone, and it is my dog snoring very loudly.
Well, I was afraid it was a person on the call snoring.
I thought the same thing.
But everyone was muted. So I'm like, it's got to be her. I bet there's an animal.
I apologize. My dog is 90 pounds and 10 years old. So thank you for pointing that out. It's not a person like hanging out in my office. It's my large dog. So thanks, Colin. I also appreciate the call to action. And also another call to action is because a lot of these are sort of state specific, it's really to pay attention to what's happening in your state. For instance, I assume it was a grown man snoring. Thanks, Colin. So what's happening in states, for instance, I'll just take Virginia. They just released this policy update. This is how we're changing our Department of Education policies so that trans youth cannot use their authentic pronouns, have to use, the bathroom that aligns with their sex assigned at birth, et cetera, et cetera, et cetera. And what you can do is comment. If you live in the state of Virginia or have advocates that live there, reach out to them and say, please click this link and please comment. And that opportunity is sort of specific for your state, but it's happening everywhere. There's momentum around this process and this framework. So I would say, just really pay attention to what's happening. Rebecca put another link in the chat, so I want to call out to that. And I will also kind of end with maybe a positive note that on Rebecca's theme of positivity. In Texas, we had a rule passed last year in our legislative session that schools had to post signs that were donated to them that said, "In God We Trust." And there were a few like specific some guidelines for how that had to go. So it had to say "In God We Trust" in the middle. It had to have the American flag at the bottom, and then have one Texas flag. And so there was some specific guidelines, and this corporation called Patriot Mobile donated a bunch of signs to schools, and it said "In God We Trust," and they were really big and blue, etc. And what these groups of parents did is donated a bunch of signs too that were like in trans colors and in Arabic, and like all of these like really fun "In God We Trust" like pride colors. And so the schools wound up having to post these signs too all over their school. And what I love about that is that it's malicious compliance, right? So even when you get these really terrible policies that you have fought against, but they're still passed, I tend to believe that there's a lot of community members who really don't want to see hatred happen in their schools, in their communities, et cetera. And so one way you can do that is malicious compliance or total non-compliance too. A bunch of kids walked out of a school, like an entire school full of kids walked out over harmful policies that they were offering in their school district, and they can't put every single kid in the school in ISS, right? So I think there are still ways that you can advocate. And then if things even pass, like get creative about showing inclusion and belonging. Ibe, I see you're unmuted.
Yeah, I was just wondering, is it possible for like the LGBTQIA NRT to draft a statement? Not something that everyone in open has to sign, because I'm sure there are folks who don't agree. But I think it would be a good thing to have out there to make everyone aware of what's going on, and to give them something where if they wanted to have language, because not everyone knows how to even talk to this issue. Here are some things that can be done, or we feel that, everyone should have equitable treatment. And, or something along that line that we could make available to the network at large, where we could get a little bit more momentum going in a more positive vein, rather than, all the hatred and vitriol.
Yeah, absolutely. Thanks for bringing that up, Ife. So the LGBTQIA NRT is hosting or participating in, AIDPH is hosting, and the NRT had sort of helped bring together this LGBTQIA Oral Health Week that we're launching the 17th of October. And so it's like activities to bring action, awareness, engagement every day. I hope everybody will participate. And at the end of that, on Friday, there's actually a pledge that we've offered for the community for LGBTQIA plus inclusion. And so the pledge is supposed to be achievable and actionable. And I think that's one way that folks can signal commitment to LGBTQIA people and their oral health and their total health and well-being.
I mean, I'd also like to have something that we could literally send to politicians and legislators, so they're hearing this. It's not just us pledging, but that we're actually doing something.
Yeah, I think that's something that we can certainly consider. I know we have lots of templates that we can draw from to do that. So yeah, I think that's a great idea. Okay, folks, I know we're at 1 Central, 2 Eastern. So I will wrap this up and just say thank you for the time. Tanya, anything you want to add to close this out?
No, I hope everybody has a chance to take a look at, I guess, yes, take a look at the agenda, because there is just an announcement in there from AIDPH about the September ECHO on rule policy and advocacy. Annalise has been talking about that quite a bit, and I think it sounds like pretty remarkable work that's happening. So do check that out if you get a chance, and register for those. Thanks, everybody.
Thank you guys. Have a good weekend. We'll see y'all later.